Now, we are going to tackle about intellectual disability. So what is intellectual disability? Intellectual disability is a developmental disorder characterized by limitations in intellectual functioning and adaptive behavior. It typically manifests before the age of 18 and can vary widely in severity. It's important to understand that intellectual disability is not a disease, but rather a condition that affects how an individual learns and adapts to their environment. So, intellectual disability is a term used when a person has certain limitations in cognitive functioning and social skills, including conceptual, social, and practical skills such as language, social, and self-care skills. These limitations can cause a person to develop and learn more slowly or differently than a typically developing person. Intellectual disability can happen anytime before a person turns 22 years old, even before birth. The general characteristics of intellectual disability. First is the intellectual functioning. So what is intellectual functioning means? So intellectual functioning incorporates the characteristics of intelligence, the abilities assessed by standardized intelligence tests, and the consensus view that intellectual functioning is influenced by other human functioning dimensions and by systems of supports. Number two is the adaptive behavior. What is adaptive behavior means? So adaptive behavior is the collection of conceptual, social, and practical skills that have been learned and are performed by people in their everyday life, which includes the following. So there are three areas of adaptive functioning, and these are the conceptual, which is it includes in this the language, reading, writing, math, reasoning, knowledge, and memory. While in social is the empathy, social judgment, communication skills, the ability to follow rules, and the ability to make and keep friendships. While in the practical is their independence in areas such as personal care, which is the hygiene, personal hygiene, the job responsibilities, managing money, recreation, and organizing school and work tasks. So the third one is developmental delay. So the children with developmental delay may have trouble with how quickly they can think and their ability to understand. They might not understand instructions if they are given a lot of information at once, and they may take longer to learn new skills. Structure and routine may help them. So the next one is cognitive disabilities. So children with intellectual disabilities, sometimes called cognitive disabilities, previously known as mental retardation, may take longer to learn to speak, walk, and take care of their personal needs such as dressing or eating. They are likely to have trouble learning in school. So it includes here those children who are autistic or who have autism. They will learn, but it will take them longer, and there may be some things they cannot learn on their own. So another one is their communication skills. So how do people with intellectual disabilities communicate? So communication styles vary among individuals with an intellectual disability. Some may have verbal language, some sign language, and others use nonverbal communication styles such as gestures, vocalizations, or even eye movements. So those children with intellectual disability cannot easily meet these challenges because it's hard for them to learn new information as quickly as other children do. They might have trouble in retaining information, and they may not understand or avoid the dangerous situations.
General strategies include personalized education plans, life skills training, social interventions, visual aids such as schedules and charts, positive reinforcement techniques, assistive technologies, and involving families and caregivers in the support process. So here's the general red flags. Developmental delays occur when a child doesn't reach milestone within the expected time frame. Factors like genetics, environment, or health condition can contribute. For example, delays in sitting up, crawling, walking, or talking can indicate issues with motor skills, language development, or cognitive abilities. Early intervention like therapy or specialized education can often help address these delays and support the child progress. Cognitive challenge, difficulty in understanding and following instruction, problem solving, reasoning and learning new skills compared to peers of the same age. This challenge can stem from various factors such as neurological conditions, learning disabilities, or developmental disorders. Supportive strategies like breaking tasks into smaller steps, providing visual aids, and offering repetitions and reinforcement can help individuals with cognitive challenge navigate their daily lives and achieve their goals. The other red flags of ID or intellectual disabilities is communication difficulties. Limited vocabulary is often a characteristic of individuals with intellectual disabilities, as they may struggle to acquire and retain new words. This limitation can hinder their ability to express themselves clearly and engage in meaningful interactions. Delayed speech and language development are also common in individuals with intellectual disability, as cognitive deficits may impede their progress in acquiring communication skills at a typical pace. The next red flags of ID or intellectual disabilities is social skills challenges in forming relationships, understanding social cues, making eye contact, engaging in age-appropriate social interactions. So pag sinabi nating understanding social cues, involves dito yung recognizing nonverbal signals such as body language, facial expressions, and tone of voice which are essentials for interpreting others' intentions and emotions during interactions. So next, making eye contact is a fundamental aspect of communication that signals attention, interest, and engagement. Third, engaging in age-appropriate interactions individuals with intellectual disabilities may exhibit behaviors or interests that are not typical for their age group, making it difficult for them to participate in age-appropriate social activities or conversation. Memories and attention issues, difficulty remembering information, following multi-step instructions, staying focused on tasks, or organizing thoughts and activities. Difficulties remembering information. So, nahihirapan silang mag-retain or mag-recall ng information. Nakaka-apekto ito sa kanilang ability to learn new concept.
Accommodation. Accommodation for intellectual disability may include extended time for tasks, modified assignments, or testing formats, preferential seating, use of assistive technology, providing visual aids, or writing instruction, breaking tasks into smaller steps, offering verbal prompts or reminders, and providing opportunities for repetition and reinforcement for concept.
Modifications for intellectual disability may involve altering the curriculum content, simplifying learning materials, providing additional support or scaffolding, adjusting grading criteria, offering alternative assessments, and implementing individualized education plans tailored to the student's needs and abilities. These modifications aim to ensure that individuals with intellectual disabilities can access and succeed in their educational environment. Modifications for intellectual disability are used to address the needs of students with intellectual disabilities in their education, so where it is includes First is altering the curriculum content. This involved adjusting the topics, complexity, or pace of the curriculum to better suit the needs and abilities of students with intellectual disability. Next is simplifying learning materials. The example of materials such as textbooks, worksheets, and presentations are modified to make them easier to understand and more accessible for students with intellectual disabilities. Providing additional support or scaffolding includes offering extra assistance, resources, or guidance to help students with intellectual disabilities comprehend and complete tasks. Another is adjusting grading criteria may be modified to take into account the individual progress and achievements of students with intellectual disabilities, ensuring they are assessed fairly on their abilities, and offering alternative assessments. These alternative forms of assessment, such as oral exams or project-based assessments, may be used to evaluate the understanding and progress of students with intellectual disabilities in a more suitable manner. And lastly, implementing individualized education plans are personalized plans developed for each student with a or with an intellectual disability, outlining specific goals, strategies, and support services to meet their unique needs and abilities. So, these modifications aim to create an inclusive educational environment where individuals with intellectual disabilities can participate in school activities and learn and succeed alongside their peers.